Famotidine is a medication used to treat stomach and intestinal ulcers, and to prevent them from coming back after they have healed. It can also be used to treat certain stomach and throat problems, such as erosive esophagitis, GERD, and Zollinger-Ellison syndrome. This medication works by reducing the amount of acid produced in the stomach, which can help relieve symptoms such as persistent cough, stomach pain, heartburn, and difficulty swallowing. Famotidine belongs to a class of drugs known as H2 blockers. It is also available without a prescription and can be used to prevent and treat heartburn and other symptoms caused by excess stomach acid. If you are taking this medication for self-treatment, make sure to carefully read the instructions so you know when to consult your doctor or pharmacist. The recommended dosage and best time to take this medication should be discussed with your healthcare provider. When taking famotidine tablet peptic ulcer agents, you should follow your doctor's instructions. This medication is usually taken once or twice daily, with or without food. If you are taking it once daily, it's best to take it right before bedtime. The dosage and length of treatment will depend on your medical condition and how you respond to the therapy. If you are giving this medication to a child, the dosage may also be based on their body weight. Your doctor may also recommend other medications, such as antacids, to help with your condition. It's important to take this medication regularly in order to get the most benefit from it. Try to take it at the same time each day to help you remember. Do not increase your dose or take it more often than prescribed. And do not stop taking this medication without your doctor's approval, as this may delay the healing of the ulcer. If you are using non-prescription famotidine for self-treatment of acid indigestion or heartburn, you can take 1 tablet with a glass of water as needed. To prevent heartburn, take 1 tablet with a glass of water 15 to 60 minutes before eating food or drinking beverages that cause heartburn. Do not use more than 2 tablets in 24 hours unless directed by your doctor, and do not take it for more than 14 days in a row without talking with your doctor. If your condition does not improve or worsens, make sure to tell your doctor. If you experience headache, constipation, or diarrhea while taking famotidine tablet, consult your doctor. However, many people using this medication do not experience serious side effects. It's important to tell your doctor if you notice easy bruising/bleeding, signs of infection, or mental/mood changes. Seek immediate medical help if you experience fast/slow/irregular heartbeat, severe dizziness, fainting, seizure, or signs of a serious allergic reaction such as rash, itching/swelling, or trouble breathing. Remember to contact your doctor for any other effects not listed here. And if you are in the U.S., call 1-800-FDA-1088 for side effect reporting, or in Canada, call 1-866-234-2345. Before taking famotidine, make sure to talk to your doctor or pharmacist if you have any allergies, as this product may contain inactive ingredients that can cause allergic reactions. It's important to also discuss your medical history, especially if you have immune system, kidney, liver, or lung problems, or any other stomach issues. If you experience symptoms like heartburn with lightheadedness, sweating, or dizziness, chest/jaw/arm/shoulder pain with shortness of breath, or unexplained weight loss, seek medical help right away. Also, if you have trouble swallowing food, bloody vomit, vomit that looks like coffee grounds, or bloody/black stools, it's important to get medical help immediately. It's crucial to note that famotidine should not be used to treat children younger than 12 unless directed by a doctor, and older adults may be more sensitive to the side effects of this medication. If you're pregnant, talk to your doctor about the risks and benefits of using famotidine, and if you're breastfeeding, consult your doctor before taking this medication. It's important to be aware of any potential drug interactions with famotidine. This medication may interact with other medications, affecting how well they work or increasing the risk of serious side effects. It's important to keep a list of all the products you use, including prescription, non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with famotidine is fezolinetant. Additionally, there are some products that require stomach acid for proper absorption, and famotidine decreases stomach acid, potentially affecting how well these products work. Some of these affected products include atazanavir, dasatinib, certain azole antifungals, levodocaconazole, pazopanib, sparsentan, among others. It's also important to note that famotidine should not be taken with other products that contain famotidine or other H2 blockers such as cimetidine, nizatidine, or ranitidine. Be sure to discuss any concerns or questions with your doctor or pharmacist. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can reach your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center for assistance. It's important not to share this medication with others. In addition to taking this medication, making lifestyle changes such as reducing stress, quitting smoking, limiting alcohol, and adjusting your diet by avoiding caffeine and certain spices can help the medication work better. It's best to talk to your doctor or pharmacist about lifestyle changes that could benefit you. While taking this medication, you may need to undergo lab and/or medical tests such as endoscopy and kidney function tests. It's important to attend all your medical and lab appointments. Consult your doctor for more details. If you forget to take a dose of famotidine tablet, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the usual time. Don't take double the dose to make up for the missed one. It is best to take famotidine tablets at the same time every day to maintain a consistent level of the medication in your body. This will help it work effectively to relieve your symptoms. When it comes to storing famotidine tablet peptic ulcer agents, it's important to keep them at room temperature and away from light and moisture. Avoid storing them in the bathroom, and always keep them out of reach of children and pets. When it's time to dispose of the medication, make sure not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. If you're unsure about how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.